We have had a very smooth transition. The iCare Plus team has been very good to work with. We started out and we filled out kind of an evaluation of our pharmacy and everything. And they emailed us kind of the beginning study guide to look over, try to review it and everything. And so we kind of knew what was going on. And then Sam from IPC came out and she helped us. Well, basically, she helped us set up the whole thing. She trained us and made sure we knew how to use it. So we've really had a very seamless and good experience with it.
What does it mean to be future ready? The term was used the first time I heard it from IPC. The comment was made by Ashton, and he's leading the digital health division, and he said, "We are future-proofing pharmacy, and now they're future ready." The pharmacy industry is constantly changing, from new technology to emerging products, from legislative debates to innovative services. Keeping up with the clinical changes is hard enough. How does an owner keep up with the changes affecting their business, their livelihoods, and their communities that they serve? Today's episode is all about the iCare Plus platform and how you can adopt digital health to move forward and be future ready.
You're listening to the Pharmacy Podcast Network.
Pharmacy Podcast Network listeners, this is an exciting episode for us to bring to you as listeners out there. You're doing the work. We very much appreciate the pharmacists and the technicians that are in the field out there helping communities all across the nation. Today's episode is brought to you by the Independent Pharmacy Cooperative, known as IPC. The reason why this group is special to us is we can go to IPC and ask for representation of what's really happening in the real world of community pharmacy, independent community pharmacy ownership. And they always bring us incredible guests to dig down into issues impacting 17,000 plus pharmacies throughout the nation. And they drive excellence through their membership. So their membership knows what's going on, feeds that back to IPC, and they make some amazing investments. Today's special guest is William Drilling, owner of Drilling Morningside Pharmacy. Bill, I am so excited you're here.
I'm very excited to be here today. What we're talking about is a very exciting and timely topic, and I think that this has a place in every independent pharmacy across the country.
Thank you so much. Thank you. Someone who is leading a very special division within IPC, and as you said, Bill, timely, is Ashton Maraba, and he is the president of IPC Digital Health. Ashton, it's great to have you.
Thanks, Todd. It's great to be back. I know we always have extremely fruitful conversations, and the narrative that you typically, that we engage in is extremely important, especially, during this day and age in independent pharmacy. So I'm excited to be back, and want to thank you and of course Bill for joining us on the podcast. And it's a privilege to be here on behalf of IPC as a company, our board, our team members, and of course our president and CEO Mark Asenza. A great group of individuals. So thank you.
Well, I think I should thank you too, Ashton, for bringing this opportunity to independent pharmacy.
Well, we appreciate your participation, Bill. It's been a real pleasure working with you. Gaining your insight and your feedback. Tremendous asset. As we'll probably talk about later in this podcast. A lot of the input that we received really was a testament to the discipline and the structure we put into testing the program from every phase before we roll it out to the rest of the country. So we're very excited for your participation, Bill. Thank you.
So that's a really, really good lead in, Ashton, because we have heard the buzzwords for years. Telehealth. I mean, it's revolutionized the way that healthcare services are delivered and providing convenient access to our medical providers from the comfort of their own homes. And that is going to grow. Community pharmacies that tap into home care through technology and through services are going to have a significant advantage in growing their businesses rather than relying only on the traditional way that pharmacies were being compensated in order to grow. But how does this technology benefit independent pharmacies and pharmacists directly, Ashton?
Well, that's a great question. One that we continuously try to work really hard at. A message where we like to send and circulate across the industry. First and foremost, iCare Plus empowers pharmacies and pharmacists and their staff to expand their services beyond traditional medication dispensing. It's something we've always talked about, and it literally does, based on the multiple elements that are tied into the program. With iCare Plus, pharmacists are now able to engage with patients on-site and remotely, providing medication counseling, adherence support, and conducting virtual consultations for minor health issues, which we call telepharmacy light. So we've really baked in several components that we felt were gaps in solidifying a pharmacist as a role player in remote patient care, and validating the profession by having that starting point at the pharmacy under the iCare Plus Virtual Healthcare Center. When you think about where CMS stands with reimbursement for and the CPT codes that they've rolled out for remote patient monitoring, one of the most important elements behind that process is first, engaging the patient, second, educating them, and third, conducting the follow-up. When you engage the patient, you enroll the patient, if they're a hypertensive patient, for example, into a blood pressure cuff, if that's what they're being treated for from a chronic standpoint. You need that center so you can sit down the patient, sit them down, talk to them, educate them. And then fortunately for pharmacists, they have the opportunity now to bill in states where provider status exists, and in states where there isn't provider status, it's based on the collaborative practice agreement between them and the local primary care. So, that is a significant and very important part of our healthcare ecosystem. And then obviously the phase one, the grassroots, is expanding the tools and the resources that are part of iCare Plus down to the pharmacy and outside of the pharmacy. So our pharmacists can treat the uninsured and the underinsured patient, diversify their cash program offerings. And where we have independent pharmacy members, for example, those that are in health deserts, they've literally been able to expand, and we see this going to grow their scope of care by creating an affordable and accessible method for those types of patients. So we're very excited.
Bill, I've been in the pharmacy space now. So this is my 20th year celebration in 2024. And mostly that's been attached to technology platforms. And some of those technology platforms that I've been aware of and even worked with through like APIs between a pharmacy system and the actual system was conceptually wonderful. But then when you put it into practice, it was like it didn't work as intended, because the end user, the patient, the pharmacist, the physician, something wasn't clicking. And so what I love about the iCare Plus programs, and there's more coming, is that they're tested. They're made sure that a pharmacy is using them, make sure that it's working, so that when it finally does roll out full blast, a pharmacy owner can grab it and implement and begin helping their community with these technologies. And with the iPhone and with mobile technology, everybody's ready for it. My question for you, Bill, is you're a pharmacy owner. So it's remarkable how this technology is building collaboration among other professionals as well as our patients. But what are some of the practical examples of iCare Plus in action with your pharmacy?
Well, it's really kind of a foundational piece, and there's just so much that can be done with it. And what it's really done is it's enabled us to make healthcare more accessible, to reach out to our community. And there are a lot of people without healthcare and without health insurance, and we can reach out to those people and help them. But what we can do on this, and it really enhances the medication therapy management if you're on you can see the person, you can talk to them like through the iCare Plus. And so we can do complete medication reviews. We can check for drug interactions. We can counsel the patients. And there's just so much that we can do with it. And like Ashton was saying, is we can do remote blood pressure monitoring. We can do patient education. So it's really kind of the foundation, and so much stuff is going to branch off of it.
So that's the innovation I like to hear, Bill, coming from a community pharmacy owner that has been around long enough to remember probably your first PC, your first implementation of technology to where we are today. That's the innovation that is building strength within our community pharmacies. I can see how telehealth solutions not only improve that patient care, but also streamline a pharmacy operations. Are there any challenges or barriers to implementing iCare Plus in your pharmacy?
Well, we had a very smooth transition. And one thing I forgot to mention, going back to your first question, is that a lot of people just don't have transportation. They can't get around. So our pharmacy does do a lot of deliveries every day. And this is just a very nice way that we can link to the people. They can see us, we can see them, and really create that patient pharmacist bond. We have had a very smooth transition, and the iCare Plus team has been very good to work with. We started out and we filled kind of an evaluation of our pharmacy and everything, and then we had and they emailed us kind of the beginning study guide to look over, try to review it and everything, and so we kind of knew what was going on. And then Sam from IPC came out, and she helped us. Basically, she helped us set up the whole thing. She trained us and made sure we knew how to use it. So we've really had a very seamless and good experience with it. And I'd like to say that the IPC team has been just remarkable to work with. They've been very good.
Ashton, back to the point about technology and sometimes complexities. Integration and implementation is almost as important as the technology itself in order to get up and running. So talk to us about the challenges and barriers. You run the entire department, so you probably see it from a whole bunch of different perspectives. So tell our listeners about that.
Yeah. So, this isn't your grandmother's digital healthcare program. And so I say that with a smile on my face. For the listeners, they can't see my face. It really is a vision that became a concept, that became a disciplined plan, that became what we call multi-tenant collaboration. And what that means essentially is we took a lot of partners that made sense. We looked at all the gaps, and we studied all the problems that are existing today. We realized we need to make this really easy, and we need to fill the gaps that exist in the industry. And we need to, most importantly, transition from the historical and traditional remote patient monitoring platforms or telehealth platforms that existed. And we need to make this more pharmacy centric. And it's funny, and this is a topic that Bill and I were talking about the other day, and he kind of saw that passion come out. So I'm going to try to maintain that level of passion and try to be as succinct as possible. But when we looked at all of the benefits that we can bring in order to deliver that pharmacist-centric approach, we looked at, hey, what are some things that we can do at the grassroots level in terms of a front and center approach for our uninsured patients that don't have access to a primary care? That's where we adopted the telemedicine feature. Then when we looked at, as Bill described earlier, a way of, let's say, promoting MTM or specific to our program where a prescription does come in and it's filled, how can we optimize that engagement between pharmacist and patient, make it more meaningful? And how can we reward our pharmacists for making that call? Because there's a big payout that's built into the program, where this wasn't just a program that we install in Bill's store and other independents. We also have a what we like to call remuneration part of this, where IPC is actually managing a share and a rebate. in the process. So, the telepharmacy light piece evolved as part of integrating what we call our pharmacy-centric avenue and channel to the overall product. And that's where, after a prescription comes in, it's picked up. Bill's staff and iCare Plus participants call the patient for that follow-up to make sure that the medication is actually working, it's being taken as prescribed, and so forth. We didn't stop there. One of the fastest growing categories in the industry is home test kits.
Yep.
We wanted to figure out a way to take that OTC category and combine it into the platform. Now, a very important part of our platform is the consumer side, which is the mobile app, the iCare Plus mobile app. A very important part of our platform is the pharmacist side, which is the provider platform. They're both working off of the same platform, just one side is customized more to the consumer, the other side to the pharmacist provider. And so we integrated our lab company and we integrated our manufacture of the products themselves. So when a patient buys the kit from the pharmacy, completes that test, sends it to the lab results will filter directly in to the mobile app and be available for that patient, and will also be available for the pharmacist like Bill to be able to reach out and counsel the patient on those lab results, eliminating having to go to the doctor or the actual lab and pay thousands of dollars and pursuing that exact same test and waiting many days until they can actually see a primary care. So that was integration number 2. We were very excited about that because we took something so simple in a fast growing category, ironed out the complexities. And of course, our technical experts won't always say it's as simple as I describe it. Of course, it's never going to be that simple. But I think at the end, we need to understand that we've now improved the interaction between our neighborhood pharmacy or community pharmacy and patients that needed that type of problem to be solved. Our third integration with the process was bringing in a partner in Uber Health. Uber Health is one of the fastest growing, obviously, transportation, patient and consumer transportation businesses in the world. They were very committed in supporting independent pharmacies, and we were very committed in making sure that they served the needs that we needed to in the process. So as pharmacists start to engage with iCare Plus in our phase 2 part of the program, the remote patient monitoring, as Bill mentioned, if patients can't get to the primary care that are part of a case that's being managed through the pharmacy and their primary care, or a case that requires escalation, Bill has the power of going into the platform and triggering an Uber Health ride for that patient to pick them up and take them to their medically necessary transportation. And that's a billable encounter. So we were very excited to be one of the first to make it happen through our in a seamless integration. We also launched Script Pass. So we adopted Script Pass, our own medication discount card that's unique and designed exclusive for independent pharmacies, rooting out the high admin fees that traditional pharmacies are used to seeing from some of the larger competitors out there. We needed one that was specific to our ecosystem. So that's been very successful as well since we rolled that out during our beta and moved into commercialization. Last but not least, we don't stop there. Integration, our goal is to fully integrate this into the pharmacist daily task and workflow. And so what we're looking at next is integrating into pharmacy systems, into the PMS system, certain parts of the program where it's even easier to access the platform and do other things and analyze certain data and other specific aspects of the program in treating that patient, not to mention making it even more operationally efficient for our pharmacists that are engaged in iCare Plus. So we've done a remarkable job as a group, as a team, both putting that vision to paper and then paper to code and then operationalizing it. And to be honest, we literally just commercialized on Monday. So we're very excited. And we've started our onboarding process for our Group 1 rollouts, which is targeted for sometime around just after June 21st. So
that is exciting. So, Bill, my parents are mid and late 70s, and they have no problem accessing Facebook. They have no problem turning on their phone to talk with one of their grandkids or me for that matter around FaceTime. So technology and the use of mobile technology and visual technology and telehealth meeting like technology has been around enough. So adoption is is being accepted by those key patients who are needing community pharmacies the most. And sometimes it's our older population. Sometimes it's the chronic disease sufferers that have something that's going on and on. But my question to you, Bill, is talk to me about the adoption of the telehealth system from your patient's perspective, the kind of feedback that you've received, and how that really plays right into the design of iCare Plus.
Well, yeah, it's very simple to download and to use, and we haven't really had any issues with people adopting it. They can either come in the pharmacy, and we can turn on the iCare Plus app for them. We have an iPad that it's on, or they can just download the app and do it themselves. And most people just work off of the app on their phone, so it's really been a very easy type of an app to use and for people to work with.
That's good to hear, because if our patients aren't able to access and use the technology, it's not worth anything, any bit or byte for that matter.
Right.
And it's important to be able to follow up with them. There's another aspect of letting the pharmacies know that the technology is available to them, and then how that trickles down to messaging. Bill, how are you communicating to your patients and the people in your community that this technology is now available through your pharmacy?
Well, what we've done a lot of is we've been using bag stuffers a lot. We've advertised it on Facebook and on social media, but that's about all we've done right now, because we were just like a beta test site. So we've mainly just done it in store with the bag stuffers, with social media, and just by trying to talk to all of our patients and kind of introduce it to them.
All right, Bill, here's the $1 million question, and that is, you are a pharmacy owner. People know you. I follow you on LinkedIn. We've met at the national conferences, and people will come to you that are other pharmacy owners and ask a lot of these questions about systems and technology and programs. So what advice are you going to give other pharmacy owners who are looking at adopting and implementing digital health technologies, and specifically adopting the iCare Plus model into their pharmacy?
After you assess your business and your goals, and I don't see how you could not want something like iCare Plus in your pharmacy as basically your digital health component. That it's such a big area, and we've never had the ability in the past. If you wanted to do a CMR or complete medication review, the person would have to come in the store to do it. Well, now you can just do it through iCare Plus. We can monitor people's blood pressure. We can do diabetes education. There's so much we can do on this, and we can be compensated for those services. And in Iowa, we're transitioning to a standard of care practice in the Pharmacy Act. So that will open up all the more things that we can do as pharmacists, all the more clinical services we can do. So, I think it's very important to have something like this in your store. There is people that have transportation issues. There are people in small towns around Sioux City that don't have a pharmacy that we can reach out to or can reach out to us. So I think it's really a huge and great opportunity for people.
Ashton, the pharmacies that you helped are of all sizes. You have members that are the single pharmacy. You have members that have a bunch of different pharmacies throughout different locations. What's your advice to people that are listening right now who haven't fully adopted digital health tech to embrace and service the communities that they're in? What are some of the steps that you can give them?
Yeah, thanks for asking that question. So there's a couple things that I wanted to make sure that that I mention. So when you think about last year, for example, our whole motto as part of our value proposition at IPC was that we were future proofing independent pharmacy. This year, we're future ready. Our goal is to future ready independent pharmacy, make sure they're future ready. And in order to start out with that, in order to understand what that really means, it's the mentality of understanding what Bill described as one of our original beta stores and early adopters. You really have to look at this as you have tools and resources that can now address different aspects of your community needs that we know exist. The stats are all there. The issues are all there. Not to mention, another impetus is IPC and IPC Digital Health through IPC has its own reimbursement program built in outside of insurance as part of our phase one, including a very good margin and a growing margin on our home test kits. Remember, we're a member-owned cooperative. And so, everything we make is patronage, goes back to our members. They own us. They own our program. And our job is to service them and please them and make sure they're always on the cutting edge of innovation. Even those that may be stage fright with technology, that's the whole point why it took a year plus for us to get this right. So it's seamless for mainstream, early adopters, level one adopters. We've made it extremely easy, pharmacy-centric, patient-centric. If your store, I had the fortunate opportunity along with two outstanding team members, Kelly Stovall, our VP of Pharmacy Services, and Samantha Pomeroy, our Senior Director of Pharmacy Services, to go out and visit a group of the beta sites. So I really enjoyed being in the field, and we all enjoyed and sharing our feedback with our internal team members that were always on call and there to support us at all times. So I want to make sure I don't forget them. There were stores, and like you said, Todd, there were stores that didn't have a consultation room. The virtual health center concept, iCare Plus Virtual Healthcare Center, that concept comes with the vision for any independent pharmacy that my store isn't just a dispensary anymore. It's also a center that can help offer technical resources, tools for the uninsured and the underinsured patient. And we've done it where we don't need a lot of space, whether it's in front of the store, whether it's in the side of the store. Hey, there's a vending machine that doesn't need to be there anymore, because guess what? It's more critical to combine our immunization program, for example, with the iCare Plus Virtual Healthcare Center strategy. The setup is extremely easy to do. One of the things that the members need to understand, as Bill described, we have a multiple touch deployment process, and it's part of our quality, and it's part of our certification strategy for the stores. In fact, before we leave that store, once that store is completely trained and fully implemented, a big seal certified iCare Plus certified healthcare center decal goes on the front of the store, and that helps for our social media marketing that we do for our members, and it helps identify the credibility and the integrity of what we're offering from a virtual healthcare strategy and the commitments that we uphold in order to maintain the highest degree of excellence and credentialing and standards. You don't need a lot of space, like I said. There were stores, for example, that have a consultation room. And so, we set it up as the actual virtual healthcare center room. Where you walk in there, you can have your private consultation with the telemedicine provider, or you can purchase the home test kit, and under the direction of the pharmacist or the pharmacy staff member, you can take your lab there and then ship it directly from the store. The second piece of our touch point is the virtual training. Once that onboarding form comes in, as Bill mentioned, we actually reach out to the store and set expectations and undergo a minimum of a 30-minute virtual training and expectation session. That's before we even get to the store. So we have a comprehensive program that prepares that store before the program even gets to their store. So now their mindset, their behavior, their comfort level, all of these things we're studying to make sure they're ready to embrace it and they're prepared. So when our brand ambassadors come to the store for the final implementation, they've already thought of, hey, we've got a room, it's already cleaned out, ready to go. We had stores that cleaned out sections of their store that had been piling up, just piling up, loose ends over the last, X number of years. They cleaned that out and we turned it into the virtual healthcare center. We had stores that had a broom closet that had enough space for the virtual healthcare center. Remember, we're monetizing this program. So that now is floor space that you can monetize. So there were a lot of extremely intelligent ideas that our stores started to think about when we had the virtual training and before we even got to the store. The biggest thing is believing in what future ready means. Number two, understanding that it's seamless technology. And many of the stores, if you can use your PMS system, then you will 100% adapt and be able to adopt the platform. And then number three, if you're looking to mitigate DIR fees and you're looking to expand your care and you're looking to validate your existence as a pharmacy in the eyes of provider status and a lot of our congressional advocacy, then this is exactly the right program you should have, and it's exactly the right behavioral mindset you should be ready to receive when we're ready to roll out with you. So hopefully I answered that in terms of easing the pressures and easing the pains of stores that might not be, that might not think they're prepared for a program like this. I think once they go through the initial virtual healthcare training and they learn more about it, they'll realize how easy it is to adopt it, bring it in and make the space in their store. You're not talking about a lot of space. So.
All right. Bill, on a scale from 1 to 10, 10 being the highest and 1 being the lowest, how would you rank your experience in adopting a digital health solution and strategy?
Well, I would definitely rank it a 10. And, one thing that you can have the actual digital health solution, which really works well, which is awesome. But it's also important to have the people behind it to help you, to get you through. And I can tell you that IPC definitely has the people to help you out, help you through this. And they're very responsive. They're very good to work with. And, I think it's something that we as pharmacists need to embrace and be enthusiastic about. And enthusiasm is contagious. And, to let people know what we can do. But we have had a very good experience with it.
That's wonderful.
We have been working with ScriptPass for a couple of weeks, and that's really a very nice add-on to the IPC Digital Health. It has $1 administration fee, plus we're rebated back 35 cents. But Ashton and I were talking about this yesterday, that so far my customers in a couple of weeks have saved about $1,200 using that feature. So, it's just another really nice little thing to have along with it.
I'm glad you mentioned that. Thank you, Bill. This has been an amazing conversation for our listeners. If you're watching us on YouTube or something visual, you'll see on your screen. For those that aren't and you're just listening to your podcast, don't worry. We'll have links in the show notes. I want you to take a look at ipcrx.com. Once again, that's ipcrx.com. Go to the IPC Advantage tab, scroll down where it says digital health, And there is a very detailed description of this program and the ability to reach out to IPC for more information in order to move forward with your digital health solutions and the iCare Plus systems. Ashton and Bill, this has been an honor and a privilege for me. Ashton, this has been great talking with you again. Can't wait to see you at some of the conferences coming up in 2024. And we need to have you back talking more about digital health.
Thanks, Todd. I appreciate it. Looking forward to coming back anytime.
Thank you, Bill. We'll see you out there in the conference land coming up this year.
Okay, well, take care. Thank you for having me on.